And today a topic that might be of interest to a lot of women and men out there that actually has to deal with aging and specifically what happens to our eyes as we age. Here to talk more about that is Dr. Rao Chanduri, who's an ophthalmologist. Thank you for being here.
Thank you for having me.
You bet. All right, just a reminder, this is a live chat for informational purposes only, so if you have any questions specific about your health or medical condition, you want to direct those towards a medical professional. But of course, questions are always welcome. You can go ahead and put those in the comment section, and we'll do our best to monitor to those live and also to come back to them after the live broadcast. So if you're watching this later, don't feel like you can't ask questions. This is a fascinating topic. I think it's a chief complaint of women and men as we age. These droopy eyes, these baggy eyes. What causes it?
What causes it? Well, I like to tell patients that usually the most common thing is I was just getting wiser, so older, and gravity. Gravity does a lot, so you're standing up 12 plus hours a day, and slowly the lower cheeks can be pulling down. It pulls down your lower lids. Your brows can descend or become droopy, and then you can have extra skin of the upper eyelids. And so cosmetically, sometimes patients are bothered by that. And then with the lower lids, you can have hills, which are usually caused by fat pads. And then you can have valleys because of the ligaments are very strong. And so you can have hills and valleys, and that creates a lot of shadows. And so that typically is what patients describe as bags.
So some of these things that happen as we age, can they affect us from a health standpoint, from a vision standpoint, as well as just cosmetically?
Yeah, absolutely. So there are a lot of things in which patients are bothered by the way it looks, but the reality is that it's also affecting their vision. So as an ophthalmologist, we pay attention to that too. So we check everyone's visions and eye pressure and look to see how dry someone's eye is. So we want to make sure that any surgery we do is not going to adversely affect the vision.
I mentioned you're an ophthalmologist, so a lot of people think, oh, I'm going to read the chart and you're going to put the thing up and you're going to blow air in my eye. I hate that part, but you have a very significant specialty in the area and doing these kinds of procedures. Tell me a little bit more about your training and specifically what you focus on.
Yeah, sure. So you're right, I'm an ophthalmologist, so I'm board certified in ophthalmology, but then I also did 2 years additional training in oculoplastic and orbital surgery, or eyelid, eyebrow, tearing conditions, and the orbit's the bony box that the eye sits in, so conditions affecting those areas. And I'm board certified, part of an organization called ASOPers, or the American Society of Ophthalmic, Plastic, and Reconstructive Surgeons. And so there's about 550 to 600 of us in the country. And all we do during our training for 2 years is eyelid and orbit surgery. So that's kind of our main focus. So although I'm in the Department of Ophthalmology, I typically don't give glasses or do what you typically think an ophthalmologist would do. Our focus is really the eyelid and the orbit.
And not everyone who's watching right now may know that we're at the Trulson Eye Institute, which is part of Nebraska Medicine. We've got a location here off 40th and Leavenworth. It's beautiful. And then you can also be seen out at Village Point. But this is what people might think of in many cases as a cosmetic procedure, but doing it at a place that also looks at things from a medical standpoint. What's the benefit of that?
Yeah, that's a great question. So typically when we're trying to navigate whether something's going to be cosmetic or medically necessary or reconstructive, symptoms have a lot to do with it. So if you're really mostly bothered by the way you look but don't have really significant symptoms that affect how you do things on a normal day-to-day basis, it's probably cosmetic. But there's some gray areas there. But then if you're unhappy with the way you look and you notice that you have a lot of skin, it's on the eyelashes, it's really causing problems with your vision, especially peripheral vision or when you're reading, then that might be reconstructive.
What are some of the other things that you can do from a cosmetic standpoint, aside from just what we're kind of talking about with the baggy, droopy eyes?
Yeah, absolutely. So it's really important to look at both the eyebrows and the upper lids and the lower lids and the cheek. There are a lot of conditions in which people like rosacea, where surgery of the lower cheek area is going to cause a lot more swelling, so we want to pick up on some of those other subtle conditions. Sometimes bags are reversible. And patients have medical conditions we can treat with just medicines. So actually surgery in those cases might make things worse. But we want to address all of those areas to try to get the best outcome possible. So for example, someone may come in with a lot of excess skin of the upper lids and is wondering, hey, can we do some surgery to help with that? But the reality is maybe it's because the brows are really droopy and we really need to focus on the brows first and then the eyelids.
It's the kind of thing that starts with a consultation. Like you may say, I'm unhappy with this, or something's bothering me, or is there something I can do about it? you yourself don't have to figure that out. So if people come in for a consultation, what kind of things can you look at and what should they expect?
Yeah, so I'm happy to report we have a really great team. With starts with Barb Stone, who's our lead technician, and she looks at all the patients who are coming in and looks at what records we need to get to make sure that we have all those things. We really don't like to reinvent the wheel unless we really have to. So we kind of look in all those records for some of those more complex conditions. But for cosmetic procedures or cosmetic surgery and stuff like that, you come in, we check your vision, check your acuity. We use the slit lamp, which is a microscope, to check the function of the eye, make sure everything's good there. And then I usually will take a picture of you, and then we'll blow it up on the screen, and we'll just talk about every single thing that I see, and then really want to have the patient communicate with me and we're going to have a shared plan, essentially.
Is there a particular good or bad candidate for this? I'm sure you see men and women. Is there a certain age range? Anything in general people need to consider health-wise before they would have a procedure like this?
Yeah, so typically our surgeries are outpatient procedures, and but we definitely want to make sure that's the safest for the patient. So we do like to stop blood thinners and other things. So if someone has a lot of heart conditions or recently had a stent and is unable to come off on the aspirin, it might make sense to wait on eyelid surgery. Most of our eyelid surgeries are elective, so a patient can kind of decide when they want to do it. So that would be kind of some of the main considerations if you're on blood thinners.
I think you get through the health points, you realize you're a good candidate for the surgery, this is something that you want to do. What can you expect from the actual procedure itself and the recovery?
Yeah, so we do surgery both at Village Point. You already mentioned that we see patients out there, so we also do surgery there.
2 convenient locations.
Yep, 2 convenient locations, and the main hospital too, if you have a lot of multiple medical conditions. And then across the street in our state-of-the-art Fritz Surgery Center, which is just a few steps down the street. So typically Renee Moore, who's our surgery scheduler, and she's also our insurance expert, is going to make sure that everything is good to go on the day of surgery. We really don't want any surprises on the day of surgery. I usually come in the morning, and the nurses are going to check you in. You're going to speak to anesthesiologist. Let me talk to you a little bit about the vast majority of surgeries, about the anesthesia itself. It's just monitored anesthesia. So you're asleep just for a few minutes. We numb up the eyelid area, and then you're awake for the rest of the procedure. We have good conversation and good music going.
I like it.
Yep. And this way, patients are really able to go home the same day. So 99% of our patients are able to go home the same day.
Is it patient's choice on music, or do you work that out together?
Yes.
They can influence
yes,
it. We
they can
discuss
influence
genre.
it. Yes,
But
I'm very
here,
open with the music. Yeah.
And your team here has obviously, they've shown us a great welcome as we've come in today to make everything feel just comfortable and like you kind of know what's on, and that you're a part of the team and part of what's going on as well.
Absolutely.
You mentioned insurance, and a lot of people are probably wondering, is that something that you can work out in advance? Because if it's just cosmetic versus medical, that's something your team can help them figure out, basically.
Yeah, I mean, it's kind of a gray line. So sometimes I have patients coming in thinking they have a cosmetic concern, and the reality is that they fully are within the reconstructive realm, and vice versa. So Renee, who's our kind of insurance expert, she'll work with the insurance provider to see whether they meet the qualifications for that, and then we can go from there.
Important question for you. What are their reactions after they have the procedure?
Great question. So I always tell patients, it's not really a compliment if someone says, "Oh, your surgery looks great." That's not a compliment. What we're going for is, "Wow, you really look, well rested today. You look like you're different. You look brighter. You look happier." And those are kind of the compliments that we want. And to that extent, we try to do surgery using kind of minimally invasive incisions, so that there isn't a big scar profile. For the upper lid, we try to make the incisions in the lid crease. So once we remove the extra skin, that lid crease or wrinkle basically hides the incision.
It's not like you're making people look like a Snapchat filter. This is, and that's, if you're doing that to yourself, there's other options out there that can make you happier about yourself. So if it's something that you've considered, anything else that I didn't ask you that I should have in regards to what people would need to know about this types of surgery?
Yeah, I think the main thing is you already mentioned it. If you're curious, the best thing is to come in and then just seek a consultation. Then we can kind of talk about it and see what the options are for you.
Sounds good. Thank you for your time today.
Yes, thank you very much.
And if any of you watching have questions, go ahead and post those below. We'll keep an eye on those as the day goes on. Again, they can see patients here near our Midtown campus, or of course out at Village Point. If you want more information, go to nebraskamed.com. You can search eye care, eye surgery. You can search for Dr. Tenduri's name, Or you can call the phone number, super easy to remember, 402-559-2020.